Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well. We are going to talk about another question of cardiology. A 76-year-old man with no significant medical history presents to the clinic for his annual checkup. His only complaint is mild exercise intolerance that he attributed to his advanced age. His physical examination is only significant for an ejection systolic murmur that is louder upon auscultation with the patient in the upright position. What is the single most likely cardiac defect that this patient has? A. Tricuspid regurgitation. B. Mitral regurgitation. C. Mitral stenosis. D. Aortic stenosis. E. Aortic regurgitation. We are going to explain it. And the answer is aortic stenosis. And we are going to explain. Aortic stenosis is the most common type of valvular heart disease in patients with the age of 65 years. As we can see here, the patient is 76 years old with ejection systolic murmur that is louder upon auscultation with the patients in the right position. This is the specification of aortic stenosis. Okay, remember that a congenital bicuspid valve predisposes to both aortic stenosis and aortic regurgitation. A normal aortic valve has 3 cusps or leaflets. A clincher for an exam would be an elderly patient who is complaining of exercise intolerance or who is otherwise asymptomatic. They will mention a type of systolic murmur that is louder when the patient sits upright, as we can see in the history of this patient. Okay, the murmur for aortic stenosis is an ejection systolic murmur, loudest in the aortic area or second intercostal space, right sternal border, and radiates to carotids and is louder in expiration. Aortic stenosis causes degenerative calcification is the most common cause in older patients about 65, and bicuspid aortic valve is second most common cause and is usually in the younger age group. Clinical features of aortic stenosis: the patient complains of dyspnea, angina, and syncope episodes. Remember, the murmur for aortic stenosis is an ejection systolic murmur, louder in the aortic area and second intercostal space, right sternal border, which radiates to carotids and is louder in expiration. In short videos, I'm explaining different types of aortic or different types of cardiac murmur. You can watch them when you can explain, and you can know the different types of aortic murmur and their position, the place and the point of the murmur, which we can hear on auscultation. Thank you for your attention.